understanding different rental requirements, knowing where to begin your research, having trusted support is all going to make a difference with your arrival. And that's what Health Carousel wants to do, is provide you with that support, let you know that we're here for you each step of the way. All right, so we are going to move on to our next segment. It is nursing in the USA. So we are going to focus on something that many of you have asked about, and that is growing your career as a nurse after you arrive in the United States. So whether you're just getting started or you're thinking about your next steps, this conversation will hopefully help you move forward with confidence in knowing your different options of how you can grow your career in the United States. I am going to welcome two of my colleagues, Ryan and John. Thank you so much for joining us today. I am so excited. How are you guys doing?
We're doing really well.
Perfect. Good. Well, I know this is a question that we get a lot from our nurses. And actually, a conversation I had with one of our nurses the other day, I know it's not always an option for them if they choose to move to another country and work. They don't always have the option to grow their career. So I definitely know it's something that they want more information about, that they want to grow their career once they're in the United States. So I think that this segment will be very informative to all of our viewers that we have online right now.
No, thanks a lot, Courtney. And so a brief introduction of myself. I am Ryan. I am one of the clinical support nurses here at Health Carousel and also one of our career coaches. And with me is John.
And like you said, my name is John Laird. I am the success manager that gets the opportunity to work with all of our HCPs as they're coming to the end of their assignments, specifically helping them with continuing their education and that enrollment process.
Awesome. And so, yes, like Courtney said, we just wanted to talk a little bit about the career opportunities here at Health Carousel as you embark on your journey in the U.S. and really what opportunities lie ahead there for you. And so at Health Carousel, we talk a lot about the full circle of support, and one of those pillars being, accelerating your career. And that often starts with just understanding what your educational pathway could be or what opportunities are there for you to help, really accelerate through that. So for many nurses, especially those trained outside the U.S., it's not always clear what your step path looks like. But we definitely wanted to help support any, thoughts or ideas you may have to obtaining a BSN, a master's degree, wanting to maybe become a nurse practitioner down the road. And how does that degree fit into your long-term career planning? So, John, let's start right there and maybe talk through what exactly are nursing degrees and why do they matter for international nurses wanting to build their career in the U.S.?
Yeah, absolutely. So we have quite a few different MSN degrees and even NP options as you are wanting to progress your career, depending on which direction you want your career to go. If you're wanting to, become a nurse educator, or if you're wanting to learn a little bit more about the number side and getting your MSN in informatics. Or you could even, want to focus on bedside nursing. So you might get your NP in gerontology. So there's quite a few different options that we have when it comes to continuing education here in the United States.
Awesome. So how would, say, one of our Health Carousel nurses go about utilizing Health Carousel's help in terms of obtaining one of those degrees?
Yeah, so Health Carousel has a partnership with Chamberlain University, and we have a program designed to start after you finish your initial assignment with Health Carousel. The program is wonderful. It's designed around working nurses, and it is, many options, whether you need to get your BSN, your MSN, your NP, your DNP. We will help you through the entire enrollment process. And one of the big advantages is that it's a fully funded, paid for program for our international nurses.
Awesome. I know you said working nurses there. So what would working while achieving your nursing degree look like?
So Chamberlain has a program that is specifically designed around working nurses. So nurses that are working anywhere from 36 to 40 hours a week. They have a really structured program of being able to take a certain number of credits per 8-week session. That way, our working nurses aren't getting overwhelmed with the amount of education that they're trying to accomplish, and being able to, spend time with their family still and, do those things that they need to do in the hospital as well.
Awesome. No, that's great information. So one last question I have for you is, what are the benefits of working with Health Carousel to gain the nursing degree that you may want to obtain?
Yeah, so I would say probably one of the biggest benefits is that, like I said, we fully pay for it. It's not a reimbursement program. We actually pay for it as you are in school. And then there's one of the other benefits is that there's no additional time commitment after you finish your degree program. So you're able to continue to move on to another school or another hospital or anywhere after that after you finish your education.
Awesome. And I guess a little curveball here, unplanned question. So say I arrive in the U.S., who or how would I go about connecting to maybe learn more about this opportunity once my career gets underway?
You can connect with your IES once you have your international employee supervisor assigned to you, and they can help you connect with either me or one of the clinical career coaches.
Awesome. No, thanks, John, for being, such a big part of the full circle of support and all of the valuable insight that you offer. So it's definitely appreciated.
Oh, absolutely. Now, we also know that pursuing an advanced degree isn't for everyone, especially maybe right when you come into the country. So we have some other options as well. As a nurse yourself, Ryan, I know that you're also one of our clinical career coaches, and I would like to ask you about some of the other options that we have that isn't necessarily going back to school and continuing their education, if that's all right.
Yeah, absolutely.
How can Health Carousel help their nurses who are wanting to grow and develop as professional nurse, but don't want to pursue an advanced degree?
That's a great question. And so there are two pathways, right? So we do understand that not everybody has, advanced education on their horizon, maybe not really something that's in the bag for them immediately. But, we definitely want to offer a lot of support to those nurses who want to pursue and grow within their clinical careers. And so the two main ways we do that is through our career coaching offerings with myself and other members of our clinical team, all nurses here at Health Carousel, to help just support in goal development, long-term, short-term goal, discussing maybe what it is you want to do and achieve throughout your nursing career. And then also through the clinical ladder, right? So Health Carousel's clinical ladder is a great way to help facilitate and gain a lot of the experience and things that go along with continuing your professional growth as a registered nurse.
Now, as a career coach yourself, what are some of the things that you specifically can do to help a nurse that is interested in one of our programs? What advice do you give them?
Right. So as a career coach, we work with all of our nurses and help kind of just understand what is going on for you in your current life, your current work life, clinical life there at your facility. What can we do to help support any clinical development goals you may have, maybe specific certifications, trainings that you want to achieve, or it could be something as simple as CE, obtaining CE credits and talking through, how do you go about getting those and how do you continue to grow and gain that education. And then the other big part is just goal development, right? A lot of what professionals, whether you're a nurse, a doctor, inside the hospital, outside the hospital, right? You're always focused on goal development so that you can have something to strive for and achieve. And so we break that down into short-term and long-term goals, talking through what those could be, and then help putting together a professional development plan to help kind of map out how you might be able to sort of set those stones to walk on moving forward to get to your clinical goals.
Absolutely. Now, all that sounds wonderful. Now, for one of our nurses that want to schedule with their clinical career coach, how do they go about doing that?
So we have our employee website you can go to, and there is under the full circle of support, the option and opportunity to schedule a time with a career coach where there will be different scheduling links to find a good time that fits your schedule. When you do arrive here to the U.S. at your 90-day mark into your assignment, you will be assigned a career coach, and that will be your career coach throughout your entire journey and career with Health Carousel. So you can connect with your IES, request help scheduling, or you can reach directly out to your career coach through one of those scheduling links.
Now, one of the other things that you mentioned was the clinical ladder. What is the clinical ladder?
Right. So clinical ladders, that's a very broad term. Everybody, has a little bit of their own definition. So clinical ladders originally really being generated within healthcare organizations, hospitals, and facilities is a professional growth tool that is used to help facilitate and encourage continued education and development of your healthcare staff, primarily focusing in on nursing. And so Health Carousel wanted to really meet this opportunity to grow and develop their nurses. And so we developed our own clinical ladder to help do that. And so it is a 4-tiered approach. And so as you progress through your tenure with Health Carousel, you have the opportunity to apply and climb up your ladder and really grow your professional journey. And so there are some requirements involved there in terms of what you have to achieve, and all those requirements are based on how do we develop and encourage you to grow, right? So whether it's obtaining CE credits, growing within your unit where you're working, if taking advantage of charge nurse opportunities, preceptor opportunities. Community volunteerism is a big thing that we pride ourselves on as healthcare workers, right? Giving back to the community and getting involved. So a lot of opportunity to complete the requirements that are there, again, designed to improve and grow as a professional, but it has a lot of great incentives and things that we are willing to offer to you really as again, fuel to your career growth, but also a reward for your wonderful success.
Well, you mentioned some incentives. So what are some of the benefits that's offered by Health Carousel's clinical ladder for all of its nurses?
Right. So keeping it clinically focused, really wanting to help nurses obtain those things that maybe they want to achieve, right? That do cost money, right? Unfortunately. So we understand that the financial burden to get some of these things can be, quite heavy. We wanted to offer this. So, starting with Professional Nursing Association memberships, as you embark on your clinical ladder journey through Clinical Nurse One, we'll actually pay for your membership to join maybe your nationality specific nursing association. And then as you get to Clinical Nurse 2, we'll then help, pay for your membership to your specialty specific nursing association. So like if you're a med-surg nurse, which I believe like 50% of our nurses,
almost,
and a majority of the nurses in the US work in the medical surgical environment. That would be like the Academy of Medical Surgical Nursing. Mm-hmm. We would pay for your membership to join that association. And then as you progress further, the things, kind of grow in terms of their impact. So we would also, as you get to Clinical Nurse 3, help pay for you to become a certified specialty nurse. So again, your med-surg nurse certification, you could be a critical care certified nurse. Those things that, again, represent career growth and achievement. But also, at the same time, we want to help support, the financial impact that can have trying to pursue that goal. And then, some of the smaller things that we help with is, if you need CE credits, you have access through your HealthStream account that you are enrolled into as you begin your preparation to come to the United States. You have continued access to that account throughout your entire career with Health Carousel. And so that's a great place to go to get what are known as continued education credits that you need for your licensure renewal within the state where you're licensed each renewal period. And then finally, clinical ladders are just great ways to demonstrate career growth, build your resume, and show either your current facility or future employers down the road on the journey you want to take, what you've done to not remain stagnant in your career, right? The best way it was explained to me is doing all of these things helps demonstrate that after school, you didn't just stop learning. You continue to learn and update yourself with the best practices within your specialty. And then it's a great way to get some recognition, some swag items from Health Carousel, and then also